on the Q&A. Just let me say that 3 times more people are watching this webinar than they did in the past webinars. And I think that's a reflection of the fact that this is an important topic. And in the questions that are coming over, nearly everyone is saying that it's self-evident that we should integrate. Mm-hmm. But the challenge is how. So many of you have covered that. So I wonder whether, starting with Alan and then just giving all the speakers a final say in what would be the next step for us as a global community or a national community to take this agenda forward. Alan, do you want to start?
Okay, yes, thank you. Thank you, Raman. I think all of us, we would totally agree with that. We should integrate the oral health with general health. But I think the problem is for those non-dental health care providers, educators, and public health specialists, they are not generally familiar with oral disease and their effect on general health and a person's quality of life. And this has perpetuated an artificial separation or a gap of the mouth from the rest of the body. So I think maybe because we should have begin from the education. Maybe for those dentists, we should learn more about systemic disease. And in the other way, those physicians, during their continued education or during their education, maybe they should also install some dental disease in their curriculum. That's my idea.
Good, thank you so much. Shuti, can I hand over to you with what would be your final remarks about things that we could do in the short term?
I think we all agree this is important, but as Bettina mentioned, what's our political approach? So I think we link with the global priority issue. For example, non-communicable diseases is currently the UN and WHO's major concern. So we link with the priority topic and we visualize the missed opportunities. If oral health and general health can be integrated, how much improvement we can generate in the reduction of premature mortality from NCDs, we can help. So I think we link with the priority topic, we show the missed opportunities. And the third thing is we need champions and to persuade everyone that this can be done. And by doing this, it's truly helpful for the whole picture. Thank you.
Thank you. Mengistu, can I hand over to you? What would be your parting words about how we can take this agenda forward?
I mean, from the different discussions, I can say that it can be done. And there are already, although small scale, experiences which are there. We might not have like a magic bullet to recommend that it should be done in this way, but we need to see our approach in line with the local context. And I probably want to take the word from Professor Shuti that we need to have champions in doing these activities where they can be models also for others.
Thank you. Bettina.
Yeah, I think we are and we have built our own cages. Some of the cages are golden, some are less golden, but it's up to us to break them down. And I think it's Bruce who has done something in Rwanda. every place will have its own and local way of doing. Sometimes it is easier to do something from scratch where there is not too much system and not too much rules already around. I think in this case we will have to learn from a lot of the low and middle income countries who find creative solutions and try to bring them back to high income countries. I would say that we work with our governments, but they cannot do everything on their own. We have to be open to also give up privileges, and the team working will hurt perhaps at the first beginning. Who wants to give up anything? But it hurts only a short moment, I would say, like the dentist says, and then you feel much better. So that would be my last word, because we have no chance to do anything else. Thank you.
Good. Well, thank you, everyone. Can we have the next slide, please? So my role is to give some take-home messages. For me, I think all the speakers have highlighted the central premise that integration is good. It does not dilute quality. And even with task sharing and transferring of some tasks to other groups of the healthcare professionals, only enhances the quality and the appropriateness of that care. Integration also is important not only for low-income countries where workforce is a challenge, but in high-income countries. And it can be summed up with many people have said in the oral health context, we need to put the mouth back in the body. Every dentist who looks in the mouth has to remember the impact it has with the rest of the body, and of course everyone looking at any aspects of health, and everyone has to remember that the importance of the mouth and the mouth plays. So putting the mouth is very important. All our speakers have highlighted the importance of political engagement and also for community engagements as well, fully understanding the tasks that need to be done. For me, all that is summarized in the fact that we need to develop leadership skills in all our professions, because it's only through good leadership where we're bringing about the change. All this has been summarized in April 2019 in the Taiwan Declaration. And we commend that to all those who are listening to this webinar, that the declaration actually puts together some of the framework that's going to be needed and the issues that people have raised to bring about better integration of oral and general health.